Let's get NCLEX ready together. We're diving deep into the world of psychiatric statement. Drinking 2 bottles of wine per day and not admitting to a drinking problem is an example of reaction formation. False. Drinking 2 bottles of wine per day and not admitting to a drinking problem is an example of denial. Psychiatric statement mastery. Ace the Psychiatric Alternative Format section on the NCLEX. Psychiatric nursing is an underrated nursing topic and is one of the most daunting topics in the NCLEX. In this video, we're diving deep into the world of psychiatric statement, dispelling myths, and arming you with the knowledge and skills to master this crucial part of your exam. Get ready to transform your understanding and approach to psychiatric disorder. After each statement, I'll have brief pauses to give you time to react and determine whether that statement is true or false. Then I'll give the answer and continue. Feel free to pause the video after each statement if you need more time to think about it. You can consider this as one of those videos where you can listen in during a walk between classes or on your commute. Ready to start? Statement 1. Primary insomnia and narcolepsy are examples of dysomnia. This statement is true. Statement 2. REM sleep is the 4th stage of sleep. This statement is false. REM sleep is the 5th stage of sleep, which can last to an hour. Statement 3. Safety is the priority of a sleepwalking client. This statement is true. Statement 4. Those with circadian rhythm sleep disorders should avoid caffeine at night. This statement is true. Statement 5. The common symptom of obstructive sleep apnea syndrome is high blood pressure. This statement is false. The common symptom of obstructive sleep apnea syndrome is snoring. Statement number 6. Nightmare disorder and sleep terror disorder are examples of parasomnia. This statement is true. Statement 7. Somatoform disorders occurs because of a psychological reason. This statement is true. Statement 8. The heart rate slows down and the body temperature drops during stage 2 of sleep. This statement is true. Statement 9. The first stage of non-REM sleep can last up to 2 hours. This statement is false. The first stage of non-REM sleep can last 5 to 10 minutes. Statement 10. Those with primary hypersomnia have difficulties performing tasks in the morning. This statement is true. Statement 11. Those with psychotic illness have an altered reality perception. This statement is true. Statement 12. Psychotic illness can be progressive or come in episodes. This statement is true. Statement 13. Schizophrenia does not have an exact known cause at this time. This statement is true. Statement 14. Positive schizophrenia symptoms include flat affect, allogia, and avolition. This statement is false. Negative schizophrenia symptoms include flat affect, allogia, and avolition. Statement 15. Normal functions are distorted with positive schizophrenia. This statement is true. Statement 16. Those with catatonic schizophrenia have a lack of response to the environment. This statement is true. Statement 17. Paranoid schizophrenia clients will have loose association, neologism, or clang association. This statement is false. Disorganized schizophrenia clients will have loose association, neologism, or clang association. Statement 18. Erotomanic delusion is the belief that something is wrong with his or her body. This statement is false. Somatic delusion is the belief that something is wrong with his or her body. Statement 19. If the client believes that she is married to Justin Bieber, she has an erotomanic delusion. This statement is true. Statement 20. Lack of connection between topics is seen in loose association. This statement is true. Statement 21. The nurse should blame the client for the addiction because they should resist. This statement is false. The nurse should not blame the client for the addiction. Statement 22. Nasal irritation is the common finding with lorazepam addiction. This statement is false. Nasal irritation is the common finding with cocaine addiction. Statement 23. Liver impairment is the short-term effect of alcohol abuse. This statement is false. Liver impairment is the long-term care effect of alcohol abuse. Statement 24. Hallucination and seizures are early signs of alcohol withdrawal. This statement is false. Hallucination and seizures are late signs of alcohol withdrawal. Librium is given during acute alcohol withdrawal or anxiety. This statement is true. Statement 26. Symptoms of alcohol withdrawal peaks after the first 12 hours after the last drink. This statement is false. Symptoms of alcohol withdrawal peaks after the first 24 to 48 hours after the last drink. Statement 27. Symptoms of alcohol withdrawal include tremors, hypertension, and tachycardia. This statement is true. Statement 28. Symptoms of cocaine withdrawal include depression or restlessness. This statement is true. Statement 29. Symptoms of benzodiazepine withdrawal includes anxiety or seizures. This statement is true. Statement 30. Substance intoxication is irreversible. This statement is false. Substance intoxication is reversible. Statement 31. Two most common eating disorder are anorexia nervosa and bulimia nervosa. This statement is true. Statement 32. Russell's sign is seen in a client with anorexia nervosa. This statement is false. Russell's sign is seen in a client with bulimia nervosa. Statement 33. Risk factors of eating disorders include low self-esteem and poor body image. This statement is true. Statement 34. The nurse should be concerned if the client continuously skips dinner. This statement is true. Statement 35. Absence of menstrual cycle is a common symptom of anorexia nervosa. This statement is true. Statement 36. The nurse should not allow a client with bulimia nervosa to use the bathroom for 90 minutes before the meal to prevent unhealthy purging habit. This statement is false. The nurse should not allow the client with bulimia nervosa to use the bathroom for 90 minutes after the meal to prevent unhealthy purging habits. Statement 37. Antisocial personality disorder can be cured. This statement is false. Antisocial personality disorder occurs from childhood and cannot be cured. Statement 38. A client with paranoid personality disorder will have a lack of trust in others. This statement is true. Statement 39. A dominating trait is expected in a client with dependent personality disorder. This statement is false. A submissive trait is expected in a client with dependent personality disorder. Statement 40. A client with antisocial personality disorder will lie and break the rules without regard for anyone's safety. This statement is true. Statement 41. Antisocial personality disorder is seen more in female than male. This statement is false. Antisocial personality disorder is seen more in male than females. Statement 42. The major personality disorder include antisocial, borderline, dependent, and paranoid personality disorder. This statement is true. Statement 43. A client who can't make a decision without her mother's approval has a dependent personality disorder. This statement is true. Statement 44. Don't listen to what your husband tells you to do is the correct response to a female client with dependent personality disorder. Statement is false. The nurse should not tell the client what to do and should listen to the client's concerns. Statement number 45. A client with paranoid personality disorder will have fear of separation. This statement is false. A client with dependent personality disorder will have fear of separation. Statement 46. Anxiety is expected when a client with paranoid personality disorder feels that the situation is out of his or her control. This statement is true. Statement 47. Personality disorder is classified when two or more areas are affected in cognition, affectivity, interpersonal functioning, and impulse control. This statement is true. Statement 48. Symptoms of antisocial personality disorder are not usually prominent until adolescence. This statement is true. Statement 49. Signs and symptoms of antisocial personality disorder include unstable mood and behavior. This statement is true. Statement 50. Eating disorder associated with exposure to a traumatic event. This statement is false. Dissociative disorders are associated with exposure to a traumatic event. Okay, that was the first 50 true or false statements. How did you do so far? If you got in this far, I hope you're getting the hang of it because you're halfway there. Are you ready to power through the next 50 true or false statement? Don't forget to head over to cutienurses.com/start and sign up for my email list to grab your 160 free digital flashcard. And hey, while you're here, smash that red subscribe button below to stay updated with all of our latest insights and tips. Let's get NCLEX ready together. Now, let's get going with statement 51. Risk factors of dissociative disorders include emotional abuse and childhood traumatic experience. This statement is true. Statement 52. Dissociative disorders occur in males more than females. This statement is false. Dissociative disorders occur in females more than males. Statement 53. Reality testing tests the client to see if he or she can tell what is real and what is not. This statement is true. Statement 54. A client with depersonalization disorder will describe the feeling as an outsider observing the moment. This statement is true. Statement 55. Someone with multiple identities has dissociative identity disorder. This statement is true. Statement 56. Someone with dissociative fugue is pretending to forget one's own identity. This statement is false. Someone with dissociative fugue forgets one's own identity and does not remember who he or she is. Statement 57. It is not possible to recover from dissociative amnesia. This statement is false. It is possible to recover from dissociative amnesia and usually does not happen again. Statement 58. There is a cure for depersonalization disorder. This statement is false. There is no cure for depersonalization disorder. Statement 59. Cognitive disorders can occur as a result of brain tissue damage causing impaired cerebral functioning. This statement is true. Statement 60. Reversal is possible with dementia. This statement is false. Reversal is unlikely for dementia. Statement 61. Decline in cognitive thought is in the early stages of vascular dementia. This statement is true. Statement 62. Amnesic disorder is also known as multi-infarct dementia. This statement is False. Vascular dementia is also known as multi-infarct dementia. Statement 63. Signs and symptoms of severe Alzheimer's type dementia include loss of speech and appetite. This statement is true. Statement 64. Healthcare providers go by 4 stages of Alzheimer's type dementia. This statement is false. Healthcare providers go by 3 types of Alzheimer's type dementia. Statement 65. Delirium can be masked as dementia. This statement is true. Statement 66. Delirium has an acute onset. This statement is true. Statement 67. The Global Deterioration Scale is based on 7 stages of Alzheimer's type dementia. This statement is true. Statement 68. Someone who paces back and forth, gets agitated easily, and is unable to recognize family members is exhibiting signs and symptoms of moderate Alzheimer's type dementia. This statement is true. Statement 69. Altered acetylcholine levels and altered immune function is seen in Alzheimer's. This statement is true. Statement 70. The nurse should be concerned if a client with depression is suddenly acting happy and giving away personal items. This statement is true. Statement 71. Hypermania episode is the mild form of mania. This statement is false. Hypomania episode is the mild form of mania. Statement 72. The nurse should tell the client with bipolar disorder that the behavior is unacceptable. This statement is false. Telling the patient with bipolar disorder that the behavior is unacceptable is not going to change the situation. The nurse should come up with a distraction and pull the patient away from the situation. Statement 73. The nurse should give the client privacy during a panic attack. This statement is false. The nurse should not be leaving the client and instruct deep breathing. Statement 74. Sundowner syndrome usually alleviates in the morning. This statement is true. Statement 75. The nurse should encourage the client to refrain from having sex. This statement is false. The nurse should teach safe methods when engaging in sexual activity. And hey, you're 3/4 there. Just 25 more to go. Good job, guys. Statement 76. Frotteurism and somnophilia are examples of paraphilias. This statement is true. Statement 77. The nurse should prioritize establishing a nurse-patient relationship and providing support when the client is feeling depressed with sexual dysfunction. This statement is true. Statement 78. Sexual aversion disorder is the avoidance of genital contact with a partner. This statement is true. Statement 79. Electroconvulsive therapy is commonly used for somatoform disorder and chronic schizophrenia. This statement is false. Electroconvulsive therapy is not commonly used for somatoform disorders and chronic schizophrenia. Statement 80. Universality is sharing common experiences and responses to feel that one is not alone. This statement is true. Statement 81. Catharsis is unselfish by thinking about others before self. This statement is false. Altruism is unselfish by thinking about others before self. Catharsis is letting go of suppressed negative feelings to feel renewed. Statement 82. Understanding life goes on after the death of a loved one is an example of existential factors. This statement is true. Statement 83. Milieu therapy provides a controlled environment to prevent negative behavior. This statement is true. Statement 84. Haloperidol can cause neuroleptic malignant syndrome. This statement is true. Statement 85. Altered mental status and rigid muscles are signs and symptoms of neuroleptic malignant syndrome. And this statement is true again. Statement 86. Score of 23 and higher on a mini mental status examination indicates mental impairment. This statement is false. Score of 23 and lower on the mini mental status examination indicates mental impairment. Statement 87. Beck's Depression Inventory is a 21-item scale to evaluate symptoms of depression. This statement is ding ding, true again. Statement 88. Case questionnaire is a depression screening tool. This statement is false. Case questionnaire is an alcoholism screening tool. Statement 89. Reality therapy helps the client to be aware of negative thoughts and to focus on the present. This statement is true. Statement 90. Achieving goals set by the group is the responsibility of group member in a group therapy. This statement is true. Statement 91. Goals have been fulfilled in the termination phase of group therapy. This statement is true. Statement 92. Drinking 2 bottles of wine per day and not admitting to a drinking problem is an example of reaction formation. This statement is false. Drinking 2 bottles of wine per day and not admitting to a drinking problem is an example of denial. Statement 93. A 7-year-old wetting the bed after witnessing domestic violence is an example of regression. This statement is true. Statement 94. A laissez-faire manager provides little direction to the group and has a lack of leadership. This statement is true again. Statement 95. The nurse should continue to provide care for the patient with a DNR. This statement is true. Statement 96. The psychiatric LPN is allowed to do sterile dressing change and reinforced discharge teaching. This statement is true. Statement 97. The nurse should not tell the client to calm down. This statement is true again. Statement 98. A married minor is still not considered emancipated. This statement is false. A married minor is considered emancipated. Statement 99. Almost there, guys. Headbanging, scratching, and eyeball pressing are examples of self-mutilation. This statement is true. Last statement 100. Psychiatric patients cannot retain the civil rights to communicate with family members until they are released. This statement is false. Psychiatric patients retain the civil rights to communicate with the outside world. Wow, you made it through these 100 statements like a champ. You're really nailing the psychiatric nursing prep for the NCLEX. Seriously impressive. But before you go, I got something else lined up for you. Check out this next video right here. It's packed with more invaluable insight and tips that you won't want to miss. And if you haven't already, remember to hit that red subscribe button. By joining our community, you'll be the first to get access to the best resources and strategies to conquer the NCLEX. Keep up the great work, and I'll see you in the next video. Happy studying!